ncIMPACT is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.
Health outcomes for African American men can be worse than for others. And this disparity is most clear when it comes to prostate cancer. This is ncIMPACT. I'm Anita Brown-Graham. Health outcomes often vary among people of different races and ethnic backgrounds in our state. In Edgecombe County, the prostate cancer mortality rate is nearly twice the state average, and it's even higher among low-income African American men. Barbershops across the county are working with healthcare providers to increase prostate cancer awareness. ncIMPACT's David Hurst looks at how these changemakers are raising awareness, encouraging screenings, and saving lives.
Yep, and his brother going to NC State.
Barbershops can be home to great conversations.
Her family.
But in Edgecombe County, a handful of barbershops have become ground zero for a new conversation.
That's a good thing.
They're talking prostate cancer.
My first reaction was like, I'm 28 years old, like I can't even get tested for prostate cancer. But the idea and the thought of being able to help out my county, just talking to people about it and sharing the issue of it to have a better outcome.
Brandon Richardson is a barber at Master's Touch Barbershop in Rocky Mount.
They tried to give me an upgrade yesterday.
He was one of the first barbers involved in the Edgecombe County Barbershop Partnership.
And go back.
It's a program that aims to raise awareness about prostate cancer and screenings.
Guys around here and other areas, nobody wants to get tested for prostate cancer because they feel violated as a man. And like I tell them, either you find out that way or you want a doctor telling you that you have a certain amount of time to live.
In Edgecombe County, the death rate for prostate cancer is 42%. That's compared to the statewide average of 23%.
I was surprised because it's like this small town and those big ratios, it's like it can't be possible, but then it's true.
The research was compiled by Dr. Caroline Ames, a urologist with Vidant Health. She played a role in helping create the Edgecombe County Barbershop Partnership.
And I think they were a little bit shocked when I laid out some of the numbers for them and explained how our community in Tarboro is really suffering. And it's the young black men that are dying of prostate cancer, and we need to reach out and get them checked. And I think they were really bolstered by that idea that they could reach out and help these folks.
Research shows the high mortality rate in Edgecombe County is linked to a high number of low-income African American men who are diagnosed with prostate cancer at late stages, often when it's too late to treat.
Just this morning, I saw 2 new patients at the hospital, and both of them have PSAs greater than 200, and both of them are having severe problems, one with kidney failure and the other with severe bone pain. And I feel like, oh no, this could have been prevented.
Anybody in your family ever had prostate cancer?
In the past 3 years, 10 barbers across 7 barbershops have had hundreds of conversations with their customers about prostate cancer.
What in the world?
It's a topic that many barbers find easy to approach within the trusted walls of their shop.
Some guys have been cutting 5-6 years. So, they're comfortable. I know their family, I know their children, I know their birthdays, I know the anniversary days, stuff like that. So they're willing to listen, but it's on them to act on it.
The barbers attend quarterly meetings for education and training. They learn about the best ways to start conversations about prostate cancer, as well as facts and myths about the topic.
Well, first we had our first meeting, and they actually talked to us, and they educated us on a lot of stuff that we didn't know. So they actually educated us, to what we need to tell our, customers.
For Eddie Arnold, prostate cancer runs in the family, so he's seen firsthand the importance of early screenings.
I have 2 of my family, 3 rather, 2 early detection, 1 hard-headed, wouldn't go get tested. When he found out about it, was too far gone. So, so is he now. So, and the other 2, they got early detection, they got treated, they're doing fine.
And for Charles Williams, when he was in his 40s, he was well aware of the disparity with African American men in prostate cancer.
A lot of men are afraid to talk about it, or they just don't talk about it. And even you have people that have had prostate cancer that don't really talk about it.
He ended up being diagnosed at 50 years old, but doctors caught it early enough to successfully treat it. Now he's been cancer-free for 7 years.
When you hear the word cancer, it's always going to shock you. There is no replay. This is not a game. And once you sit down across from a doctor and he's telling you, hey, this can really take you out, and this is what we're going to have to do, you have to take control of your health.
Reverend Thomas Walker of Rocky Mount was diagnosed when he was 47. He's now in remission and leverages his platform as a minister to inform people about the dangers of the disease.
If you want to get my attention, regardless of what my schedule is, just bring up the word prostate.
He says at the time of his diagnosis, he knew very little about prostate cancer, thinking some of his symptoms were a result of him growing old. But then a simple checkup revealed the bad news.
It was particularly devastating for me, and I found myself with my whole life flashing before me.
And similar to the barbershop partnership, Walker's church partners with Vidant Health and other community health organizations to help get the word out.
They learn to rely on the people that they see on a regular basis, be it the school, the barber, the beauty shop, those neighbors that they see on a regular basis. They form those trusting relationships there. And so we found that the most effective way to reach the people that we really are trying to reach is through working with those people that they trust and they see on a regular basis.
For Richardson, he says he'll continue having these conversations in his shop, hoping it will compel his customers to go get checked.
I work part-time at my godfather's funeral home, and some people come in there and they pass from prostate cancer, and you're like, that's somebody that I missed that I could have talked to. But mainly in here, I talk about it. If you can help yourself, that's the first thing. You got to help yourself. You got to be willing to go. And this stuff is free. Tell them it's free. Just go get checked.
So health disparities are anytime you have a particular health outcome, let's say that you're interested in looking at cancer death rates or heart disease death rates or stroke, some of the major health complications. Anytime you see a difference in those health outcomes between 2 groups of people, then we define that as a health disparity. Eastern North Carolina is very unique in that, it's very rural, but it's also one of the few areas in the country that has that is part of the diabetes belt, the stroke belt, and in the northeastern part of the state is part of has some of the highest colorectal cancer death rates in the country. So it's a very unique area, and but there are lots of challenges that are the result of issues like poverty and discrimination and lack of access to quality health care.
A lot of these solutions sound like there are partnerships required. How crucial are the collaborations when it comes to tackling this issue?
It's critical. I mean, in smaller communities, oftentimes there's distrust when you have people from the outside coming in, and they don't understand the culture and they don't understand sort of the unique nuances of a community. So having that partnership, like say, ECU and local governments or local community-based organizations, it's critical to the success of any type of initiative. When you start talking about people's health, it gets really personal, and so you have to be able to have those collaborations with the community to make it successful.
And why do you think communities, healthcare leaders should make this a priority?
Well, I mean, you know, we're having conversations now about health insurance. So, you know, we're having conversations about Medicaid transformation, Medicaid expansion. You know, if you look at globally in the United States, by far we spend more money on health care than any other industrialized country in the world. And so people are starting to say, what kind of bang are we getting for our buck? Why are we spending so much money? But our life expectancy in the U.S. is really lower than many other countries, many other industrialized countries. So I think it's important for us to, from a moral perspective, but also from an economic perspective, to say, how can we do a better job of being stewards of the funds that we have to ensure that people are living healthy lives?
As a two-time cancer survivor, Chelsea Gibbs knows what it's like to be resilient. The first time she was diagnosed, she was only 24 years old.
I mean, I was definitely shocked, and then I was just kind of upset because I'd never really heard of it. Nobody in my family has had breast cancer. And I was too young, basically. I'm like, how are you 24 and you have breast cancer? So I was really upset.
Doctors say they caught the cancer early while it was non-aggressive and in stage 1. 12 years later, she was diagnosed again after discovering a lump during a routine self-exam.
It was just something I just did. You don't expect to find anything, but if I hadn't had all of that, I honestly don't know where I would be. I've never thought about that. I probably actually wouldn't be here.
Since she caught it early both times, she was able to successfully go through treatment and is now in remission.
And under mammography, which we call stereo.
Unfortunately, that's not the outcome for some African American women diagnosed with breast cancer. Studies show that African American women are 42% more likely to die from the disease than white women.
I have a lot of patients who present after 6 months of a cancer sitting in them because they thought it's a mole or it's nothing. A lot of times it's denial, that they're worried about it could be cancer, and that makes them not go to the doctor, which is very counterproductive.
Dr. Jay Manicum is a medical oncologist at the UNC Cancer Center at Nash. He says Edgecombe County, which is majority African American, has one of the highest mortality rates for breast cancer in the country.
It sometimes reminds me of a developing world, which I'm very familiar with during my med school in India. Very healthy, otherwise young females presenting with a very advanced breast cancer, and you wonder why. Why didn't they seek medical attention sooner?
So on our mammogram here, we're looking at heterogeneously dense breasts.
His colleague, Dr. Brian Singleton, says white women are more likely to seek regular screenings, and they discover breast cancer at earlier stages than African American women.
The biggest issue is getting women to actually come to get a mammogram. The fear of compression, pain, the fear of facing a palpable mass that they feel that they don't want to address because other events get in the way, other needs of their family, life events get in the way. So women, well, in their 40s and 50s, will fail to get an annual mammogram simply because of life events.
Singleton says the odds of surviving breast cancer are much higher the earlier they can detect it. The 5-year survival rate for stages 0 and 1 breast cancer is close to 100%, whereas stage 4 is only 22%.
So our goal is to capture it in that first year, because then we could, when we're having that conversation with somebody and say, ma'am, this is an 8-millimeter mass, I can tell you that prospectively speaking, 99 out of 100 women are going to beat this. And so it gives them that hope to say, hey, you've got this.
But both doctors say breast cancer disparities include not only race, but also geography. Research from the CDC shows those with breast cancer in rural America are less likely to be diagnosed early and receive the necessary treatment. Laura Body lives in Rocky Mount and was diagnosed with an aggressive form of breast cancer in her 30s.
I remember I was actually sitting in our break room, and one of my very close coworkers was there, and I remember telling her the news, and I just didn't even know what to do with myself. There were so many questions I had and so much information I wanted right then. It's after you get that phone call, you just don't know what's next.
It took 8 rounds of chemotherapy and 6 weeks of radiation to treat her stage 2 cancer, She's currently in remission and credits her oldest son for helping her get through treatment.
When I was on my second round, he was holding my hair off the toilet for me when I was sick after one of my rounds, and I will never forget that. I mean, and he was tapping me on the back, "Mommy, you'll be okay."
Doctors found the cancer after Body discovered a small lump on her breast. She says if she had not followed a hunch to have a doctor take a look, chances are she wouldn't be here sharing her story.
I think about the treatments I went through and how brutal they were, how hard they were on my family. You know, I think about the stories that friends and loved ones have told me about how they actually lost their loved ones to the chemo, not to the actual cancer, because it was too hard of a battle. So the earlier it's detected, the less your body is going to go through to have to fight it.
It's also why Gibbs is sharing her story. She says she hopes her positive outcome can lead to other successful treatment stories.
If you're going through this, then talk to people about it. Talk to women about it. Talk to men about it that may be supportive. Talk to men that might actually have breast cancer. You know, the more we talk about it, the more knowledge people have about it, the more there's not any type of stigma on it, and you can just kind of face it head on.
Well, I'm joined now with Cornell Wright, the Executive Director of the Office of Minority Health and Health Disparities. Cornell, if you would, just give me a brief snapshot about what's going on at the statewide level when it comes to tackling health disparities.
Well, thank you for having me. It's really a daunting task. We have a lot of work that we're doing with the Department of Health and Human Services here in North Carolina, and a lot of it is focused on equity, and that's the health equity is looking at how we can give opportunities for everyone to have good health. So there's a lot of programs, services, tasks that we do, technical assistance across the state in different areas, whether it be in public health, mental health, and just different branches of everything that DHHS touches that we try to tackle to make sure that we're addressing these needs that we're seeing across the state.
And what kind of partnerships are required in order to come up with solutions to some of these issues?
So we're only as strong as our partnerships, right? And so making sure we're having strong connections locally, regionally, nationally, and internationally in some cases. So our local health departments are a strong source of partnership. And then there's other areas where you see some of the bigger players, too many to name, but DHHS has been a convener, a connector, and a provider of services and partnership with all these entities that have a stake in the game.
Is there a one-size-fits-all model that communities can implement, or does it really depend on the characteristics and the unique qualities of a particular community?
Yeah, definitely it is not a one-size-fits-all. There are foundations that this work can provide, but everybody's unique and each community is unique and their needs are going to be different. You can have informed decisions based on what other people have gone through, but ultimately you have to kind of figure out how does this fit where you are and who you are, especially for the work that we need to do together.
This year, nearly 175,000 men in the United States will be diagnosed with prostate cancer. The risk for African American men is 60% higher than it is for white men. Learn more about how you can educate yourself about prostate cancer and other issues that affect your health. Visit unctv.org/ncIMPACT for more. Next time on ncIMPACT.
Financially, the first 2 years, it was rough.
Many North Carolina school districts struggle to recruit and keep teachers, but Dare County Schools have a solution to that problem.
ncIMPACT is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.